is that some folks, this part, and these directly from patients that I've actually treated, the duodenum is so hypertrophic. Like if you work your biceps, right? The biceps get bigger. You're doing it on purpose. That's hypertrophic, right? You want your biceps to get bigger because they're working hard. That's the idea, right? But if it's hypertrophic to the point where it's dysfunctional, right? It causes that dysfunction. And so I've worked on patients where the duodenum, for example, or other parts of the intestines feel like a PVC pipe. You flip it and it feels like plastic. It's so stiff. That is that the muscle tissue is so thick, the muscle tissue is so hypertrophic that if you imagine that's, basically the thickness of the intestine, that muscle wall is so thick that the hole the food goes through gets really, really tiny because the walls are so thick that the hole is really tiny. Now they suffer from malnutrition. They're eating food, but it's not passing quickly enough through the duodenum. So people will say things like, every time I eat a meal, it feels like the food is in my gut for 4 hours, 5 hours, 6 hours. I just feel like I'm still full. And then I want to eat, but then I get nauseated. What's happening? That food is in your stomach for 4, 5, 6 hours, 12 hours. What's happening to that food in your stomach?
Just sitting there.
It's rotting. And so at some point, your body, you leave a plate of food on the counter for 12 hours, you're not going to eat that food, right? So your body wants to get rid of that. So you become nauseated because of that. And the person is undernourished, so they're hungry. The body's asking for food, yet every time they look at food or they try to eat food, they become nauseated and they got this weight on their stomach. Okay? That can be because the duodenum is so hypertrophic that the food can't pass through enough.